Histology of the Pemphigus vulgaris is very important. Actually, you should know it. Main points. When the patient has Pemphigus vulgaris, and to diagnose, we take the biopsy. So, in the perilegional tissue, there's a cystic intraepithelium separation. Basically, it occurs above the basal cell layers of the epithelium. Okay, then the sometimes the entire superficial layers of the epithelium are stripped away, leaving only basal cells, which is actually described as a row of the tombstone. Okay, second, the cells of spinous layer of epithelium typically appear to fall apart, acantholysis occur, and the loss of cells tend to assume a rounded shaped cells, which is called Zinc cells. Very important. When the desmosomes attachment are lost, so cells are floating. These cells are known as Zinc cells actually. To mild to moderate chronic inflammatory cells infiltrates usually seen in the underlying connective tissue. We can see it. You can see here actually this epithelium and epithelium split actually. Now this how you take the again that biopsy, it has been shown in diagnosis basically on clinical grouping, histo and direct and indirect immunofluorescence. Then basically immunofluorescence is a laboratory technique that utilizes the fluorescent label antibodies to detect the specific target antigens. Means these are the antibodies to detect specific antigens. The fluorescent dye can be detected by a fluorescent microscope, which actually depending on the messenger used it well to emit a specific wavelength of light. The direct immunofluorescence uses a single fluorescent tagged antibody to bind directly to target antigen in the tissue. Okay, means what happened then in the direct fluorescence, you uses a single fluorescent tagged antibody to bind it to a specific antigen. Which means you use a single. In indirect immunofluorescence, there's actually two steps in which in primary the unlabeled antibody bind to the target, which actually means you take an unlabeled antibody, you bind to the target, after which a fluorescent labeled second antibody is used to detect the first antibody. So you use the second antibody to detect the first antibody. This happens actually in this fluorescence label primary antibody and then antigen. Okay, this has been shown you. Then the indirect is used label the second antigen and the primary antibody, then you actually check through that. The diagnosis is basically that the direct immunofluorescence of examination of perilegional tissue demonstrate antibodies IgG and IgM either, and complement C3, which is very important actually. The intraepithelial space between epithelial cells in almost all the patients with this disease. The indirect immunofluorescence is typically positive in 80 to 90 cases, demonstrating the presence of circulating autoantibodies in the patient's serum. In differential diagnosis, you give the paraneoplastic pemphigus, mucous membrane pemphigus, bullous pemphigus, erythema multiforme, and lichen planus. Pemphigus, like other oral and cutaneous eruptions, may occur in patients taking certain medications like NSAIDs, acini, and inhibitors. Actually, acid inhibitors. Coping with the pemphigus is basically treat the skin injuries immediately and according to that. Maintain good oral health and avoid exercise, sun exposure, and wear high SPF sunscreen. Practice stress management like yoga, meditation, and Tai Chi. Okay, what are the treatments to given to this patient is basically systematic corticosteroids, usually prednisone, and in immunosuppressant drugs you give azathioprine. Okay, the significant side effects which is associated with long use of corticosteroids, the patient may have actually diabetes mellitus, weight gain can occur, osteoporosis the patient can have, means the long term use of corticosteroids, this patient has diabetes, can weight gain, osteoporosis, peptic ulcers, severe mood swings, the patient has increased susceptibility to a wide range of infections. Initially high dose of steroids is given to control the disease, then a low dose is maintaining to control the disease. Okay, these actually again are a summary which is given to you. Pathology, causes, risk factors, who are at risk, sign and symptoms, and diagnosis. And this is the comparison which we will study after when we study also pemphigus.